You are listening to 40 Weeks with Vanessa Merton, host of the Pregnancy Podcast. Thank you for tuning in to the 40 Weeks podcast. Welcome to week 24. Your little baby is growing from the size of an eggplant last week to the size of an ear of corn this week. That little one is getting taller and measures 11.4 inches or 29 centimeters, and they weigh just over a pound or 500 grams. They are gaining more weight each week, mostly baby fat, growing organs, bones, and muscle. Your baby has developed that sweet face that you will soon see with eyes and ears placed just where they should be. They are big enough that they can no longer do cartwheels and tumbles, but they are just as touchy-feely with their surroundings as they have been. Your little one is also even more attuned to sounds outside the womb. If a loud noise disturbs them, they might be restless for hours. That tiny, beautiful face is almost formed, complete with eyelashes, eyebrows, and hair. Their skin is still very transparent, so if you could see inside your womb, you would be able to see all of the organs, bones, and blood vessels. As fat deposits form, they won't be as transparent. As your baby's lungs continue to develop, the cells that produce surfactant, which is a substance that will help their air sacs inflate once they are in the outside world, are being created. Your uterus is now well above your belly button and is about the size of a soccer ball. You may have noticed that your wrist and fingers get numb occasionally. Chances are this is carpal tunnel syndrome. Carpal tunnel shows up as uncomfortable tingling and numbness that is usually associated with repetitive motion, like typing. When you're pregnant, swelling causes fluids to accumulate in your lower extremities during the day, and this all puts pressure on the nerve that runs through your wrist, which causes numbness, tingling, pain, or a dull ache. Like most everything pregnancy related, this is temporary, so hang in there. Tip for dad, take a birth class. Participating in a class is going to give you a better idea of what your role is and how you can help. A birth class prepares you for what to expect, it prepares your partner, and it even does some emergency preparation in the event something comes up that you are not expecting. In labor, things can move really quickly. If you aren't familiar with different options or procedures, you could be making hasty decisions. If you are knowledgeable, you're going to be able to make sound decisions because you came prepared. Bottom line is, taking a birth class and educating yourself increases the chances that you and your partner are going to get the birth experience you want. There is a lot more on this topic on the birth class episode of the Pregnancy Podcast, and you can listen to that at pregnancypodcast.com/episode 6. Thank you for tuning in. Show notes for this episode can be found at pregnancypodcast.com/week 24. Next week, more blood vessels are forming and making your baby's skin go from white to pink. And until then, I wish you the very best on your pregnancy journey. There are so many awesome resources available to you at pregnancypodcast.com, and you can sign up with your email address and your due date to get a weekly email with a link to the episode for your specific week every week in your inbox. I look forward to seeing you in the Pregnancy Podcast Facebook group, which is a great place not only to connect with some other parents-to-be, but also to be able to ask questions and get answers specific to things that you are dealing with and planning for your pregnancy and birth.